Hi, my name is Ned Saleh. I am a scientist and I am the founder of Syncell. Today, we will talk about how to test the entire United States in 30 days and eradicate COVID in 60 days. This analysis is model independent. It's accurate because it relies only on the daily recorded raw data. It's reproducible by anyone, so anyone can take this data and reproduce it at home and will arrive at the same results that we do here. It does not depend on the COVID-19 number of tests, test rates, or fatality rates. Remember what was said, that we're seeing more cases because we are doing more tests? We will not see any of these artifacts here. They are all eliminated. So if the number of tests were low or high, or if the number of tests is going up or is going down, it will not make any difference. Remember, the models we were relying on in the past were off by, in some instances, factor of 1,000. You will not see any of that here. We're making a proposal. This proposal does not require drugs, pills, or a vaccine. It does not require increasing the test rates. It can be extended to other countries or future pandemics. It creates a useful, trackable recovery metric, more useful than flattening the curve. We call it inverting the curve. It's a paradigm shift. It proposes 60 days to eradicate COVID-19 from the USA. And this proposal was valid since April. Let's look at the data, which we can pull out from any publicly available source of data. In this case, we will take it from the COVID tracking project from the Atlantic. We tabulate the data in a very interesting way. Let's start by looking at the positives per new tests. So we take the number of positive cases and we divide them by the new tests every given day. And we plot them here in this blue curve. And then we take the number of new deaths per new positive. So every case of these positive tests here in the blue curve, we plot it in the red curve. And for reference, we just show the total number of tests and the total number of fatalities, which are tracked on these two vertical log curves right here, just for reference. Moving forward, we will just eliminate these two curves for the total tests and the total death, just for simplicity. As we stated earlier, even though the total tests and the total fatalities are monotonically increasing, we can see that the positives per tests and the number of fatalities per new positive are taking different patterns. And this enforces the point that I mentioned earlier, that all the artifacts of testing and infections have been decoupled now, and we don't see them in this analysis. Now, let's take a look at the results. Strike that. As you can see here, even though the total tests and the total fatalities are monotonically increasing, we see that the number of positives per new tests and the number of fatalities per new positive are taking different forms and shapes, even though these two curves are increasing monotonically. This reinforces the point that I mentioned earlier, that all the artifacts of testing and the number of tests and the patterns of tests are decoupled from this analysis. So moving forward, we will take these curves and we will split them and we'll look at them separately. And here is what we will find out. Because of the pressure to do more testing because we were under the wrong impression that we need more testing, we made testing free. And this unintentionally resulted in a nationwide randomized sampling just by sheer luck. And this was happening all over the United States. We actually do not need more testing. We're testing enough people. Actually, we are over testing. What we are doing is that we are wasting more than 90% of the testing resources. And this trend, again, has been true since mid-April. Let me prove that to you and why this is the case. Let's look at the two curves that we mentioned earlier. These are busy slides, but we can go through them slowly and carefully. So, if you look at the lockdown and the reopening, and look at the curve that represents the positives per new test. Again, the vertical axis here is a logarithmic curve of the percentages. So what this curve tells us is the positive per new tests represents the historical probability curve for infection. Or it could also be understood as the risk of being affected. Now, each point here may not mean much in isolation. It may not even make sense. But when you look at the flow of the data and the overlap, then it does make sense. And it doesn't mean that at every day, the number of infected people is different from the day before or the day after. There is an overlap here, and we know that there's about 3 weeks to a month of new batches of people. But this curve tells us that at any given day, the percentage of positive tests, only the percentage of positive tests is represented here by this number. Now, look carefully at this number. We started in mid-April at 20%, and we kept going down as we locked down. And then as we reopened, the numbers went up. Actually, at the bottom here in mid-June, we went down to 4% of all the tests being positive. Now, this could also be looked at as the efficiency of our testing. So in this case here, at the beginning or mid-April, we were wasting 80% of the tests. 80% of the tests were negative. We were testing people who are not sick, who didn't have symptoms, or they had false symptoms. And they walked in and they walked out of the test stations, and they were not quarantined, and they didn't have to take any action because they were not infected. And these people should not have been tested in the first place. This is what we mean here by all these tested, all these resources of testing are wasted. So there's about 90%, in this case, for example, of the test resources are wasted. On average, this number was about 10%. So if you look also here at the curve that represents the new deaths per new positive, does not mean that every person here who was infected here will be reported as a fatality here. We know there is a delay. And again, 1 point in isolation on the curve may not mean much and may not even make sense, but the flow and the overlap of the data does make sense. And notice that the probability for a new death to result from a new infection has been monotonically going down, whether the probability of infection was going down or going up. That's a very interesting thing to notice. This curve actually represents the risk of someone infected dying. And it collectively represents the pattern and trend of the risk dropping. Also, what we noticed here is that the reproductive number was dropping as we were in shelter in place. It was less than 1, and then it bottomed down here somewhere, and then it became more than 1 as we opened up, and infections started increasing, which makes sense. What we also want to notice here is that really this point gives us the answer of what the probability is of someone or a group of people or the entire United States being infected on the next day. So every point here really is a slice of the status of society. So you can imagine that at any given day here, if we go out, if we have the resources and test everybody in the US for COVID infection, we would equivalently find a number very close to this number that is represented here. This is because the sample was randomized, as I mentioned, and this curve actually represents the probability that we're going to find the infected population here in the entire USA represented by this number. So as such, this slice can now the slice here represents, as we mentioned, status of the COVID-19 at this given day. This is remarkable because now, for perhaps the first time since the outbreak of the pandemic, we created quantitative risk curves for both infection and fatality. These are risk curves based on data that represent the probability of infection and the probability of someone who is infected that they will die. Now, as we said before, it does not mean that at this given date that the same group of people are reported dying. We know there's an overlap and there is a delay, but the monotonic decrease in risk in fatality is very remarkable. So going back to this slice, what we notice that if this slice moves, it will represent the status at all these points. But as I mentioned, we know that it's not a different group of people every day. There is a delay, and based on what we know about infection, incubation, and transmission, full cycle takes about 3 weeks to a month. So since the beginning of the pandemic, we may have gone into maybe 3 or 4 full cycles of infection to recovery. And if we think that the efficiency of this curve or the probability for infections where on average 10%, just to simplify the calculations, we can think that we went through 3 or 4 full cycles. So that leaves us with 10% over every cycle of the full US population. This is close to 30 million people in the US. So the total cycles may have resulted in up to 120 million Americans who are infected, which leads us to the conclusion that we have built a very good level of herd immunity. Now that makes sense because we know that no matter what is happening here with the reported cases or infections, they were going down during the shelter in place, then they went up very fast, but the fatality are always going down based on this plot from the New York Times. So Perhaps that explains why we have a monotonic decrease in the risk of death. Now, let's do something very interesting here. We have data up to the 4th of July, the date of this presentation. But what if we push the date here outside the range of data that we have collected and we apply symptomatic, asymptotic projection statistics, that is, without mitigation planning. So if we just do some asymptotic projection of the data that we have for the risk of death, the curve that we showed before, this data will project itself out to sometime perhaps late August, where the risk of dying from COVID will be close to the risk floor of dying from a car accident. Now, this does not mean that COVID infections and fatalities are going to go away. They will not go away because, as we said, this is based on no mitigation plans. So the risk will go down, but the fatalities and the infections will not. So by doing this, we created a real forward-looking risk curve upon which we can do planning. Public policy planning should not be driven by hospitalization capacity considerations, but it should be based on risk consideration. Now, this is what flattening the curve suggests. It's a hospitalization capacity calculation. Now, we know that we don't do this with the automobile fatality model, for example. We know that when we put more cars on the road, we are going to have more fatalities. So we do not propose massive and aggressive lockdowns or put people away from the roads to prevent fatalities. We just execute because the risk levels are low. Now, the curve flattening does not really save lives in that sense because the area under the curve for flattening the curve remains constant. What we do is rearrangement of comorbidity, hoping to wait for a vaccine. But in the process of doing that, we actually cause more damage economically and health-wise. And I would like to cite here the excellent study by Scott Atlas Group from Stanford. So let's answer the big question now. Knowing what we know so far, how do we test the entire USA in 30 days and eradicate COVID in 60 days? Now, if we look at flattening the curve theory, it's based on the health system capacity, which, in my opinion, is not a very robust metric, and in some sense is a fictitious line. So what happens if we just raise the health system capacity? Would we then just flatten the curve? And a lot of us are under the impression that we already did that since we enlisted the help even of the military. And we know that our hospitalization capacity did not reach the limit in bed availability or ventilators or even ICUs. So the question remains, why did we not flatten the curve till now? Well, on the other hand, if you look at inverting the positive test efficiency curve, where it stands right now at around 10%, and we're looking now at a linear scale, the positive test efficiency curve is very low. It stands now, as we mentioned, at 10%. No one accepts a process that's 10% efficient. So in order to really be effective in combating the pandemic, we need to convert the curve for the positive efficiency from 10% on average to 90% on average. By doing that, we invert the curve. And when we do so, we increase the testing efficiency by a factor of 9. So instead of 10%, we go to 90%. 90% is an efficiency that is acceptable. So if we agree that inverting the curve is more effective than flattening the curve, then we can move forward with a plan. And the plan would be as follows. We now test around 600,000 people a day. That's a lot of testing. Actually, it continues to increase. So 600,000 tests a day at 10% efficiency can be made into 5 million tests a day by inverting the curve and increasing the efficiency to 90%. That increases the efficiency by a factor of 9. And what that means is we are going through groups of 5 million people and testing only those who are most likely to be positive. As it stands today, we're testing almost random people, and 9 out of 10 on average, they walk out with negative tests. That is not acceptable. We have to test people who are most likely be positive, just as a matter of confirmation. So if we go through 5 million people a day and we do this 30 days in a month, now we have 150 million people that we went through testing. Now, that does not mean we actually test 150 million people, but it means we swept through 150 million people. And out of these people, we decided who we test so that the efficiency of people testing positive is 90%. Now, we can do something else. We can do double pool testing, so putting 2 samples in one test, and then we can multiply that by 2, and now we have 300 million people effectively per month. If we do so, we will find out who is infected out of the 300 million people that we went through in 1 month, and we can lock these people down in a quarantine, even if on the downside, half of them were not infected. That's a small price to pay. But if one test is negative, if one test is positive, I should say, this means that at least one of the people are positive. So we quarantine both of them. If we do this in 1 month, then we can wait another month after quarantine, and we can totally eradicate COVID-19. Not just reduce the risk, as I mentioned before, from no action with medication. We know that the risk is going to drop, but the disease is not going to go away. By following this plan, we can actually eradicate the COVID-19. Now, we have to screen people, triage them, and do contact tracing before we test them, not after we test them. Before we test them, we have to make sure that we only test those who are going to test positive. And this is what we mean by inverting the curve. This will guarantee that the testing efficiency is high and will help us sweep through the entire nation in 1 month, even though we are actually testing a small fraction of them within our test capacity that we have today. Even if we have to drop this number to 500,000, yes, we can even drop our testing rate and still execute on this plan within 1 month and another month of quarantine, total of maximum 60 days to eradicate COVID-19. We could have done this back in April because the trend of the data was the same as it is today in late April. So conceptually, we could have been right now in early July COVID free. One more remark regarding physical distancing and wearing a mask. We are led to believe that both are required, but science tells us that physical distance is required because this is the range of the droplet. So if we are within a safe distance from each other, then the droplet will terminate and will not reach the other party. Now, I prefer wearing a mask because this prevents the droplets from depositing on an object. But the science tells us it's one or the other. Both are not required, even though it is nice to have. But at a price that's so expensive for closing the economy and causing a lot of small businesses to go out of business, maybe we can do with physical distancing and strictly enforce wearing a mask. And science tells us that if two parties are wearing a mask, communicating with each other, at least one of them is wearing an N95 high-end mask, the transmission probability drops to 0. Thank you.